Staying focused when you're implementing a new prevention program can be difficult. As you know, change happens all the time. There's always new practices, new medications, new literature, new evidence. And to stay focused and to drive your outcomes, sometimes you just have to take it one day at a time. But when you can have the nurse champions around you and you have a group of motivated people and you've created that culture, it makes it easy. So being able to lead and instill that passion makes such a difference.
If you're just starting your prevention program within your hospital or your organization, there are 3 things that are really important to keep the program going and to have it successful. First and foremost is know your data. Having your data really helps you to understand where you need to implement interventions. Secondly, having your key stakeholders at the table is extremely helpful when you're building your program from the ground up, because then you're able to identify the needs of everyone, as well as if there's any barriers that might exist, so that way you can mitigate those barriers and put things into place and help it be successful. And number 3, it's the sustainability and accountability of the program that's being implemented. Figuring out at what time frames could data be available. Is it monthly? Is it quarterly? To where you would know if your program is successful or not successful. And then if you see a dip in your outcomes, whether you see an increase in incidences in VTE, you're able to evaluate it more real time than retrospectively, because then you can identify if there were any changes that happened during that month. Maybe it might be a new surgeon that started who was not aware of your program and protocols that need to be in place. And then you're able to address it more real time, so that way, moving forward, you're able to continue to have the excellent outcomes.